Yeah.
Drew, it is great to see you, my friend. How are you,
buddy?
Good to see you. How have you been?
I have to get this prostate issue
Tell me more
under
about it.
control. So I empty and feel like I have to go to the bathroom. And I'm getting up more at night
Than
I want to. That's probably the single biggest thing.
Absolutely.
I want to improve not having to get up as much
Absolutely.
at night.
Let me ask you some specific questions, if I may. When you go to the bathroom to urinate, how would you describe your force of stream as being strong, medium, or weak?
Medium to weak.
Medium to weak. And when you go to the bathroom, do you feel like you're emptying yourself out all the way, or do you feel like, no, there's some urine still sitting inside
I
me?
always feel like there's still something sitting inside.
Okay, so you find that you actually have more frequency than you're used to.
Definitely.
Any sense of urgency, like you've got to rush to the bathroom right now?
Not right now,
But in general.
but at times, yes, I do have that urgency. You know, sometimes driving the car like, whoa, you know, I'm not going to make it. I have the urgency issues. At times I have problems ejaculating.
So classic symptoms for BPH. I'd like to take a look at your bladder, take a look at your prostate, because you're still very young and you're still very active.
I love when you talk like that, Kia.
Absolute pleasure. There are different modalities that we have that can actually effectively treat your BPH and at the same time preserve your sexual function. Something that's actually come around more recently that's very, very exciting is called the Resume procedure. We use steam energy to shrink the prostate. You have results very similar to surgery. So we'll take a look at your prostate, and then based on that, let's decide what you would prefer to do.
I like the way you think. We're here to fix the plumbing. Or they just put some gel up my urethra to numb me up there. I'm getting a cystoscopy.
I'm going to put a scope inside you in your urethra.
I think I'm camera ready down there.
That sounds great. You're all prepped?
Hair and makeup ready.
Oh my God, you're huge.
Well, thank you.
This is just a little bit of discomfort, about 2-3 seconds.
Ouch.
This is your urethra. Everything looks really nice and open. This is your sphincter. And you can see as I pull back, your urethra starts to get collapsed on because of the prostatic overgrowth. So that's what's actually causing the obstruction.
You think a good candidate?
Sure.
Let me tell you, that feels so good when that comes out.
In Drew's case, he's been suffering from BPH, which means benign overgrowth of the prostate.
Good to see you, Doc.
Let's get the show on the road for you.
All right, I'm ready. I'm going to be peeing like an 18-year-old.
So technologies such as Resume are really changing the field for men. This is the Resume device, and it gives off steam. When the cells are encountered with that high of a temperature, the prostatic enlargement starts to shrink over time. The first step is we're going to insert the scope into the urethra. This is where the prostate and the bladder actually join. The whole prostate gland is roughly about 2 centimeters in length. You're going to see us basically deploy the needle. I'm going to press a lever. We're going to count to 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. It's all done on that one lobe. All it just needs is just one treatment per side. So we're going to go now to the other side. We're going to do the exact same thing. So the entire treatment is now done for Drew, and most likely he will not need to be on lifelong medications. So I'm very happy for him. It's amazing. In 18 seconds, we're able to do what we typically would do with a standard operation.